Hey there, fellow phlebotomy enthusiasts. Welcome back to our channel. Today, we're going to take you through a step-by-step guide of the phlebotomy procedure, breaking down each stage to ensure you're fully equipped to perform successful blood draws. So, let's jump right in. What is the process of phlebotomy? Phlebotomy is the process of drawing blood from a vein, typically in your arm. Here's a general breakdown of the steps involved. Preparation. The phlebotomist will first confirm your identity using two patient identifiers, for example, name and date of birth, and ensure they have a doctor's order for the blood draw. They will explain the procedure to you and answer any questions you may have. They will check for any allergies you might have to antiseptic wipes, adhesives, or latex used during the process. Positioning and vein selection. You'll be comfortably seated or positioned on a reclining chair with your arm extended. The phlebotomist will locate a suitable vein in your arm, ideally one that's stable, visible, and straight. They may ask you to clench your fist to make the veins more prominent. Blood draw. A tourniquet will be applied around your upper arm to restrict blood flow and make the veins more engorged. This will be loosened or removed as soon as blood flow is established. The phlebotomist will clean the chosen venipuncture site with an antiseptic wipe. Using a sterile needle, they will carefully insert it into the vein at a lower angle, 15 to 30 degrees. You may feel a slight prick or pinch when the needle enters. Blood collection. Several vials or tubes might be filled with blood depending on the tests ordered. The phlebotomist will gently invert the tubes to ensure proper blood mixing with additives inside them. Completion. Once enough blood is collected, the needle will be withdrawn, and gentle pressure will be applied to the puncture site with a gauze pad to stop any bleeding. A bandage may be applied to the area. Sample handling and disposal. The phlebotomist will label the blood tubes carefully with your information and the test requirements. They will then handle the sharps and other medical waste according to safety protocols. The entire process typically takes just a few minutes. It's important to communicate any concerns or discomfort you feel during the phlebotomy procedure. What are the three main phlebotomy procedures used today? There isn't a categorization of phlebotomy procedures exactly, but phlebotomy itself can be broken down into three key stages. Venipuncture. This is the core technical skill of phlebotomy and refers to the act of puncturing a vein to access blood. It involves locating a suitable vein, applying a tourniquet, inserting the needle at the proper angle, and ensuring smooth blood flow into the collection tubes. Blood collection. Once the vein is accessed, this stage focuses on carefully filling the blood collection tubes. The phlebotomist will maintain proper blood flow, gently invert the tubes to mix the blood with additives, and ensure they collect the required amount for the ordered tests. Sample handling and disposal. After enough blood is drawn, this final stage involves applying pressure to stop bleeding, bandaging the puncture site, meticulously labeling the blood samples with patient information and test details, and safely disposing of needles and other medical waste according to infection control protocols. What are the 7 blood drawing steps? Here are the 7 essential steps in a blood draw. Preparation. Patient identification. The phlebotomist verifies your identity with two identifiers like name and birthday. They also confirm the doctor's order for the blood tests. Explanation and consent. The phlebotomist explains the procedure and answers any questions you have. They will obtain your consent for the blood draw. Allergy check. They will inquire about any allergies you might have to antiseptic wipes, adhesives or latex used during the process. Positioning and vein selection. You'll be seated or positioned comfortably with your arm extended. The phlebotomist will locate a suitable vein in your arm, prioritizing stable, visible, and straight ones. They may ask you to clench your fist to make the veins more prominent. Tourniquet application. A tourniquet will be placed around your upper arm to restrict blood flow and make veins more engorged. This will be loosened or removed as soon as blood is drawn. Venipuncture. The phlebotomist will clean the chosen venipuncture site with an antiseptic wipe to sterilize the area. Using a sterile needle, they will carefully insert it into the vein at a lower angle, 15 to 30 degrees. You may feel a slight prick when the needle enters. Blood collection. Several vials or tubes might be filled with blood depending on the tests ordered. The phlebotomist will gently invert the tubes to ensure proper blood mixing with additives inside them. Completion. Once enough blood is collected, the needle will be withdrawn, and gentle pressure will be applied to the puncture site with a gauze pad to stop any bleeding. A bandage may be applied to the area. Sample handling and disposal. The phlebotomist will meticulously label the blood tubes with your information and the test requirements. They will then dispose of the sharps and other medical waste according to safety protocols to prevent infections. How do you prepare a patient for phlebotomy? Preparing a patient for phlebotomy involves creating a calm and informative experience to ensure a smooth blood draw. Here's a breakdown of the key steps. Introduction and identification. Introduce yourself and explain your role as the phlebotomist. Verify the patient's identity using two identifiers, for example, name and date of birth, and confirm they match the doctor's order for blood tests. Explanation and consent. Explain the blood draw procedure in simple terms, including the purpose of the tests, if you can, and the number of tubes required. Address any questions or concerns the patient may have and answer them patiently. Obtain informed consent for the procedure. Medical history check. Briefly inquire about any allergies, especially to antiseptic wipes, adhesives, or latex. Ask if they have had any problems with blood draws in the past, such as fainting or difficulty finding veins. Positioning and comfort. Help the patient into a comfortable seated position with their arm extended on an armrest or table. Provide support under their arm if needed. Venipuncture site preparation. Locate a suitable vein in the patient's arm, ideally one that's large, stable, and easily visible. Ask the patient to clench their fist to make the veins more prominent if necessary. Apply a tourniquet comfortably around the upper arm, but not too tight, to restrict blood flow and make the vein more engorged. Clean the chosen venipuncture site with an antiseptic wipe following a circular motion from the center outwards, allowing the area to air dry completely. Managing anxiety. For patients who appear anxious, offer reassurance and explain each step of the process clearly. You can also suggest relaxation techniques like deep breathing exercises or looking away during needle insertion. Here are some additional tips. Be friendly and professional. A positive attitude goes a long way in calming nerves. Maintain a clean environment. Sanitize your hands and workspace before the procedure. Explain the feeling of the needle. Briefly mention a slight prick when the needle enters. Minimize discomfort. Use a gentle touch and avoid leaving the tourniquet on for extended periods. By following these steps, you can effectively prepare a patient for phlebotomy and create a more positive experience for everyone involved. And there you have it, a comprehensive guide to the phlebotomy procedure. Whether you're a seasoned phlebotomist or just starting out, these steps will help you perform successful blood draws with confidence and professionalism. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more phlebotomy tips and tricks. Until next time, happy drawing!